What's up, guys? Next tool that we're going through is my personal favorite, Voodoo Floss, otherwise known as compression floss. This stuff is amazing because it is extraordinarily fast and easy to use. The only downside is that it's quite uncomfortable, especially when you first start to use it. But there is no but, you don't actually get used to it. You do get used to it, but it's horribly uncomfortable. In fact, if it is comfortable, then you're probably not actually doing anything. So a lot of things happen with this. I'm going to be rolling out, I'll take off my watch, and I'm going to roll out my wrist, I'm going to roll my wrist and my forearm and kind of talk about it as we go. And you'll see some cool after effects. Right, so what I always recommend, this is the back of the band to your skin. It's a lot easier to roll out. That's not black and white, you don't have to do it like that. Highly recommend it, it's easier, it's just easier to roll. Right. Also, if you're doing your wrist, be very gentle around the wrist. So you want to put down an anchor strip where you can hold it either with the next loop of the band or with a finger, but loose, nice and easy around the wrist. This obviously takes a lot of practice. This isn't something that you just get right away, and I've done wrapping for over 100 hours. So most of your body is going to have like a top and bottom, so to speak. Like your forearm, the top of it is where like your main musculature is. The bottom part is where your access to your major blood vessels are. And so when we're going through this, I want to put around a lot of tension around the muscle and not so much around the underside where the vessels are. Or like when I'm doing like my lower legs, for example, going around my calves, I put around a lot of the tension around the calf, not so much around the shin. That's not going to be as beneficial. Maybe that makes intuitive sense to some people. All right, so anyways, I'm going to put a nice loose wrap around my wrist. Reason for that is that if you put a lot of tension around the wrist, it is horribly painful. Like it sucks, like in a bad way. You don't want to keep doing it. So I'm going to be pulling this as I go around the top, pull that tight, and then relax it. So it sticks to itself. I do about a half width overlap, nice and loose around the bottom. And I'm going to readjust my grip, pull it. It's going to go around tight across the top. And then nice and loose across the bottom, then pull it tight across the top. And you can kind of see a little bit how much it's pulling into your flesh. You're pulling it pretty dadgum tight. So what's going on with this? Number one, you're giving yourself a deep tissue massage because you're putting in a lot of pressure onto the tissues. This is latex, this is rubber, right? So it's going to tack down on the tissues and work on the layers of flesh. So as I move around, it's going to create a lot of shear, just like the massage balls do. When you get to the very end, you just want to make sure the last loop is a little bit on the looser side, so you can get your finger under there and then tuck that in to the other side. That was horribly simplistic, but honestly, I gave you everything that you need to know to put this on. It's just a matter of practicing over and over and over and over again. Like do it 100 times on every part of your body over the next year. And then from there, you're just moving. Move your hand around, move your wrist around, move your elbow, do some push-ups, walk around, make some arm circles, everything. Just move and breathe. Relax as best you can. You're gonna go for 2 minutes on this. Typical prescription is 2 minutes on, 2 minutes off. That's gonna give you time to relax. You can see my blood flow is being cut off. There's my normal complexion. Like I am pale, but you can see that I'm going pale with that. It is cutting off the blood flow. So when I take it off, it's going to rush back in. It works a lot with swelling. If there's any swelling in there, it will push it all out, and then your blood just comes rushing back in and helps to kind of rejuvenate your lymphatic system so you can have significantly greater, healthier circulation. But this is all you're doing, really. When you put it around a joint, wrist very gently, but around your elbow or your knee or your ankle, it helps to actually open up. It creates spread in that joint, just like a joint distraction with the resistance bands do. And so it just works on so many different facets. It hydrates your tissues, it resets your circulation, it gives you a deep tissue massage, it creates a lot of shear in the tissues. It does that all at once, 2 minutes. And then 2 minutes off to kind of reset it, like my hand's going numb. Can you see that? Now what's going to be cool is that when I take it off, all that blood's going to come rushing back in. There's ways to take it off really quickly. And you can see the lines that it creates because it's going on hella tight, and the blood just comes rushing back in. You typically feel warmth going in because it is blood rushing in and filling in. And that feels good. And then you just move. Keep that moving. Help the circulation to pump through. Your circulation needs movement. You need to massage it with the muscles. So you'd go 2 minutes there, 2 minutes relaxing, and then reapply for basically as much time as you have. Typically, I'll recommend going for about 5 total rounds. So on and off, on and off, on and off, on and off, on and off. And that can be like 20 minutes of just doing that over and over again. Can be kind of boring, but it gets so much work done so quickly. It's so amazing for recovery, for helping your muscles and your joints to be so much more loose, to have such better circulation, and just to function better. So if you have chronic pain, but you can handle that, it works a charm. If you just simply need to get your joints to open up a bit better, like your ankles, maybe you're going for a run, I'll use this on my ankles, and that's about all I do for a warm up for my running. And everything works so much better upstream. So 10 out of 10, highly recommend it. Get it, start using it, get used to using it. And wrapping is super simple, but it takes a lot of practice. So just sit there and practice over and over and over again. That could be your mobility work for like a solid month. That's all you do, learning to wrap various parts of your body. These primarily come usually in this width, but you can, like the Ready State, I believe has some extra thick bands, and so does Rogue Fitness, and they create the best quality bands. Other bands, like from again Faster and a few other really cheap companies, are very cheap. You might like poke your thumb through the band as you're putting it on, and they also tend to not be as grippy. So the form's not too bad, but if you do like your thigh or your calf, it might actually slide down itself, which is very irritating. So quality definitely matters for this. I highly recommend either Rogue Fitness or the Ready State quality brand. But yeah, that's about it. It tackles a lot of things, but it is very uncomfortable. First time you use it, I do recommend having someone who knows what they're doing do it for you. If you're in Southampton, I'm happy to do it for you. And I'll give you an idea of what it should feel like. It is going to suck a bit. It might take your breath away. If you start to feel really claustrophobic, which can happen, or nauseous, or you get like this impending sense of doom, which can actually happen, I'm not making that up, take it off. You are cutting off your blood flow. When you do this, it can make you feel funny. And how that expresses itself can change from person to person. So just be really mindful and wary of that. There's your medical disclaimer. I'm not a doctor. If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.